Here is how to decrease high triglycerides naturally. By the end of this video, you will learn what are triglycerides, why should we focus less on LDL cholesterol and more on triglycerides, normal range of triglyceride levels, remnant cholesterol is triglycerides' partner in crime, how to calculate remnant cholesterol without advanced testing, the role of diet in managing triglyceride levels, do statins help decrease triglyceride levels, natural supplements to manage triglycerides, lifestyle overhaul, and health in-depth tips. What are triglycerides? Triglycerides are a type of fat found in our blood that is essential for energy. However, when their levels rise too high, the health risks also climb significantly. Stop focusing on LDL cholesterol and focus on triglycerides instead. This isn't just about avoiding heart issues, but also understanding when triglycerides become a clear danger. High triglyceride levels, particularly above 500 milligrams per deciliter, can send you headlong into the throes of pancreatitis, a severe inflammation of the pancreas that requires immediate medical attention. Severe acute pancreatitis can lead to failure of multiple organs and infections, which can be life-threatening. In some ways, the medical community's focus on lowering total cholesterol and LDL cholesterol has sidelined the crucial importance of triglyceride reduction. Triglycerides are an independent biomarker linked with cardiovascular disease. This means they're not the sidekick, they're the main character. Higher levels could point to troubles like atherosclerosis and even sudden death, irrespective of whether individuals are on medication to lower lipid levels. Some studies have shown that high levels of postprandial or non-fasted triglycerides are associated with a significant increase in cardiovascular disease incidence by up to 73%. Normal range of triglyceride levels. Elevated non-fasted triglyceride levels are particularly troubling as they can flag up potential heart health issues. Non-fasted levels generally should hover below 150 milligrams per deciliter to keep your heart ticking nicely. I am going to lay it out straight. Triglyceride levels over 440 milligrams per deciliter significantly spike the risk of cardiovascular events. And what's more, even if you're not hitting the 500 milligram per deciliter mark associated with pancreatitis risk, you're not out of the woods. Higher levels increase the risk of recurrent cardiovascular events. Triglycerides have a partner in crime, remnant cholesterol. High triglycerides frequently occur together with a lesser-known lipid fraction called remnant cholesterol. This duo teams up to escalate cardiovascular complications if not managed properly. Remnant cholesterol primarily comprises very low-density lipoprotein, VLDL, and intermediate-density lipoprotein, IDL. Remnant cholesterol is a better predictor of heart attacks than other types of cholesterol, like LDL cholesterol. It has almost twice the association with ischemic heart disease. In fact, in overweight or obese individuals, triglyceride and remnant cholesterol levels are more linked to adverse cardiovascular outcomes than LDL cholesterol. High remnant cholesterol levels can help identify people at higher risk of metabolic syndrome. Calculate remnant cholesterol without advanced tests. Here's an interesting fact. You can calculate your remnant cholesterol level yourself using the data from a standard lipid panel test, which measures LDL, HDL, total cholesterol, and serum triglyceride levels. The formula for calculating remnant cholesterol is remnant cholesterol equals total cholesterol minus LDL minus HDL. For example, if your total cholesterol is 214 milligrams per deciliter, your LDL is 130 milligrams per deciliter, and your HDL is 35 milligrams per deciliter. Your remnant cholesterol would be 49 milligrams per deciliter. A remnant cholesterol level over 24 milligrams per deciliter indicates an increased cardiovascular risk. Ideally, it should be less than 12 milligrams per deciliter. The role of diet in managing triglyceride levels. Insulin resistance is a common cause of high triglycerides. High insulin levels in the bloodstream result in insulin resistance, which makes it difficult for the body to burn triglycerides effectively. That can cause a buildup of triglycerides in the body over time. It is crucial to manage your carbohydrate metabolism to get a handle on triglyceride levels. Simple and highly processed carbs are the main culprits, and reducing them can significantly lower triglyceride levels. Say goodbye to cookies, pasta, waffles, pastries, crackers, and anything swimming in high fructose corn syrup. And say hello to good fats and foods rich in omega-3s. Herring, sardines, and other omega-3 rich fish can be delicious substitutes that benefit heart health. Don't worry too much about consuming good fats. Avocados, nuts, and olives don't spike triglycerides like processed carbohydrates. These healthy fats can be your allies in the mission to lower your triglyceride levels. Cut back on alcohol. Excessive alcohol consumption can lead to elevated triglycerides due to its high sugar content and effect on the body's ability to process fats. Stay clear of the sugar trap in beverages. Liquid calories from drinks with high fructose corn syrup and sucrose can skyrocket triglyceride levels faster than you'd think. Choose water, herbal teas, or even a splash of fresh lemon in sparkling water for a refreshing alternative. Do statins help lower triglyceride levels? Here's something that might surprise you. Most randomized trials for statins, those cholesterol-lowering champs, usually don't include patients with high triglyceride levels. It means that if your triglycerides are high, statins may not be the full answer to your heart health puzzle. Supplements to manage triglycerides. Omega-3 fish oil and krill oil supplements have anti-inflammatory effects and the science-backed stamp of approval for lowering triglyceride levels. A type of sugar called myo-inositol can help reduce triglyceride levels. Another plant extract called berberine, which is derived from plants like barberry, has shown some promising benefits in several studies. Lifestyle overhaul. Managing triglycerides goes beyond just taking supplements. A complete lifestyle overhaul is what truly makes the difference. We can positively affect our triglyceride levels by changing the way we eat. Intermittent fasting and eating earlier in the day can help align our mealtimes with the body's natural rhythm and improve metabolic health. Take a walk after meals. It can help lower blood sugar and, in turn, manage those pesky triglycerides. Exercise isn't just beneficial for overall health, it's also integral in managing triglycerides. So find and stick with an enjoyable activity. Consistency is the key. Keep tabs on your metabolic health by monitoring remnant lipoproteins and keeping your triglyceride levels in check. Always consult with your healthcare provider first, make adjustments slowly, choose habits that fit your lifestyle, and don't worry too much about perfection on the first try. What matters is a long-term commitment. Health in-depth tips. Prioritize protein-rich foods. They don't spike triglyceride levels like high-carb diets can. Eating good fats does not cause high triglycerides. The main culprit is excessive consumption of total carbohydrates, mainly highly processed ones. Whole, natural foods should be at the core of your dietary approach, the kind that does not come with a barcode. If you are considering a plant-based diet, avoid falling into the trap of replacing meat with processed foods. Many people who go plant-based end up increasing their intake of processed items, which leads to higher triglyceride levels. Instead, focus on nutrient-dense whole plant foods to maintain a healthy balance. A plant-based diet may lead to a critical vitamin deficiency that may cause heart disease. Check out the next video for more information on this deficiency and how to prevent it. Genetics, high blood pressure, endothelial cell dysfunction, and metabolic health also affect susceptibility to heart disease. So this brings the question, why haven't we been paying more attention to triglycerides all along? Well, there are two ways to react to this. One is to remain stuck in the past, continuing with the old habits and ignoring emerging science. I shoot for the latter. Embrace new understanding, get ahead of the game, and put focused effort into managing our triglyceride levels, not just for the sake of it, but for the profound impact it can have on our long-term health.